Hello, I'm Dr. Rachel Paragallo-Urrutia, an OBGYN at Reply OBGYN and Fertility in Cary, North Carolina. Many of our pregnant patients are nearing their due dates and have questions and concerns specific to how the coronavirus is impacting our labor and delivery care at WakeMed Cary. So we have a few procedural updates as we understand them so far, but please understand that this virus is bringing rapidly changing recommendations, and so these current guidelines are subject to change as the situation evolves. And we at Reply are going to do our best to try to keep you apprised of all the changes, but you know it's changing quickly. And I will say that part of the reason for that is, since it's a brand new virus, we haven't had a lot of research like we have in other illnesses, and so we're learning more and more as more and more data comes from around the world. I will say as well that WakeMed Cary Women's Health Pavilion website, which is listed below, has additional updates, and I would recommend checking there frequently for any updates, especially as your due date approaches. But some questions that we've received that we thought people may be interested in hearing our response to is whether or not a support person is allowed for labor. At this time, at both UNC Chapel Hill and WakeMed Cary, a support person is allowed with a laboring mother. That is one exception to the new visitor protocols at all of the hospitals in the area. This means that right now at WakeMed Cary, you can have one support person during your labor, and this person has to remain the same for the entire admission. So unfortunately, you might have to choose between a parent and a partner or a sibling, but only one person can come into the hospital with you and help care for you and your baby after delivery. Currently at WakeMed Cary, in addition to your personal support person, doulas are also permitted in the hospital. And this is good news to me, because I think that doulas help relieve the burden of the healthcare workforce and can help them care for other patients who may be sicker or need more help. So I hope this doesn't change, but this is where it is for now. Currently at UNC Chapel Hill, doulas are not permitted as additional support persons unless they're doulas that are employed at UNC. You should continue to follow the same protocols as previously outlined. So if you are in labor, you should call the office first, you should use the same entrance, etc. One qualification to that is that if you are experiencing symptoms that might be related to coronavirus, so specifically fever, shortness of breath, coughing, those kind of symptoms, you should not follow these protocols. You should call first, and you should not enter the Women's Health Pavilion, because we're trying to, as much as possible, keep the Women's Health Pavilion geared towards laboring and childbirthing women and people. So just please touch base with us in that situation. We hope that a Reply clinician will still be available at your birth. Currently, there is a doctor or midwife on call almost every day of the month at Reply, that is from Reply. And as you know, the hospitalists continue to provide backup support to us when a Reply MD cannot be at the delivery, if an MD is needed. And so they will continue to provide us support, but our call coverage system has not changed, and luckily we're all well, and so we're able to care for you, and we will continue to try to do our best to do this as this evolves. Our goal in our medical care is to take care of pregnant people, because we know that doesn't change in an epidemic. And so as of right now, we are not being pulled to do other things in the health system, but we're focused on taking care of you. People have questions about their birth plan, and we will do our best to follow your birth plan. But as you have already heard, some of this information is evolving. And I think the biggest part of the birth plan that's going to be hard to promise us being able to follow is things like the visitor policy and whether or not for sure your doula can be there. Those are things we'll have to continue to follow. But in terms of what type of pain medicines you want in labor, and what type of music you might want to play, or how long you want us to delay cord clamping, all of those things should still be able to be followed without any changes. Remember that you can always reach us through the patient portal, and our phone lines are open during regular business hours. You can call our main number, 919-230-2100. We're also available after hours on call for urgent situations, and that number is 207-3739. Please continue to check back on our social media feed and our websites for other updates as they appear. We really appreciate you taking time to view this video, and I hope you found it helpful.